Hey everyone, welcome back to my channel. If this is your first time here, I am Bimal Maharzan, the founder of Godsphere and a survivor of chronic constipation. I am thrilled to have you join me today as we dive into the ultimate guide to personalized DIY natural home remedies for immediate and long-term constipation relief. This is a part of our masterclass in battling constipation, the survivor's guide. In this episode, we will deep dive into personalized DIY natural home remedies for immediate and long-term constipation relief. Trust me, by the end of this video, you will have a comprehensive toolkit to tackle constipation head-on and improve your overall gut health. So stick around, because the insights and practical tips I'm going to share could be life-changing. Before we jump into details, let me share a bit about who I am and why I'm so passionate about this topic. As someone who has battled chronic constipation for years, I know firsthand the pain, discomfort, frustrations that come with it. My journey from struggling to find effective treatments to discovering natural, sustainable solutions inspired me to create Godsphere. And Godsphere is dedicated to helping people like you achieve better gut health through personalized, evidence-based approaches. Our mission is to make gastrointestinal care affordable, accessible, and actionable for everyone. But before we jump into today's content, let's quickly recap what we have covered so far in this series. In the first episode, The Silent Struggle, my 7-year battle with chronic constipation, I opened up about my personal journey and the initial struggles I faced with chronic constipation. It was a tough time, and I shared the emotional and physical challenges that many of you might find relatable. Then in Everything to Know About Constipation, a former patient's guide, we delved into understanding constipation in depth. We explored its causes, common misconceptions, and why it's so crucial to get the information right. Our third episode, How I Cured My Constipation by Becoming a Scientist of My Own Body, was all about empowerment and experiment. I discussed how I took control of my own health by meticulously tracking my symptoms, experimenting with various remedies, and learning what truly worked for me. This was a turning point in my life. And in the fourth episode, Navigating the US Healthcare for Chronic Constipation Patient, we focused on the importance of effectively using the healthcare system. I share tips and strategies on how to get the right diagnosis, manage cost, and your condition with the help of healthcare professionals. In the fifth episode, Chronic Constipation Solved, Biomarkers, Test, and Your Diagnostic Path, we explored various biomarkers and diagnostic tests that can help identify the root causes of constipation. It was all about getting to the core of the issue with the right medical insights. In today's episode, which is the sixth, we are going to cover a comprehensive step-by-step guide that will help you take control of your constipation issues. We'll start by understanding the root causes of constipation and common misconceptions that might be holding you back from finding the right relief. Then we'll dive into how different organs contribute to constipation and what you can do to support them naturally. We will also discuss the critical role of nutrients, vitamins, enzymes, and gut microbes in maintaining regularity. Finally, we'll introduce you to a framework for personalizing your constipation relief efforts, ensuring that remedies you choose are tailored to your unique needs. First, We'll delve into the understanding of the constipation and why your current remedies might not be working. We'll explore common mistakes and solutions such as overuse of laxatives, ineffective fiber supplements, and why exercise alone isn't enough. It's essential to understand these misconceptions to avoid them and find the right approach for you. We will emphasize the importance of root cause analysis by identifying the root causes, the underlying causes, and tailoring remedies to your specific needs. Next, we'll examine how different organs contribute to constipation, starting with the nervous system. We will discuss the role of autonomic and central nervous system, as well as psychological factors that impact gut health. We will move on to digestive system, covering the importance of proper mouth and chewing habits, stomach issues like delayed gastric emptying, and how the small and large intestines affect stool formation. We'll also touch on the roles of liver, gallbladder, and bile ducts. Additionally, we'll look into the endocrine system, focusing on thyroid gland and pancreas and how they influence constipation. We will discuss circulatory system's impact on blood flow to the intestines and immune system's role in inflammatory diseases that cause constipation. We'll then discuss the importance of sufficient nutrients, vitamins, enzymes, and microbes for maintaining bowel movements. We'll identify key macronutrients, minerals like magnesium and potassium, and other essential nutrients such as probiotic and omega-3 fatty acids. We'll highlight the importance of vitamins for gut health, including vitamin D, B vitamins, vitamin C, and others. We'll also explain how digestive enzymes like amylase, protease, and lipase influence bowel movements, and the role of gut microbes in maintaining regularity. Additionally, we'll cover how hormones impact constipation. Following this, we'll introduce a framework for personalized home relief known as the Miracle Framework, MIRACLE, Miracle Framework. This includes assessing motivation, identifying root causes such as dietary issues, lifestyle factors, and medical conditions, and demographic factors such as age and gender. We will also assess body types using both physiological and Ayurvedic classifications, evaluate capability and opportunity by considering available skills and resources, and explore local and seasonal availability of remedies. We'll conclude this framework by evaluating the affordability of DIY solutions and purchase options. Finally, we'll dive into specific DIY natural home remedies for constipation relief. I will share my detailed journey of personalizing remedies, providing quick home remedies for calming the pain, and walk you through full day routine for permanent constipation relief and gut health. So before we get started, it's important to note that while these strategies have worked for me and many others, everyone's body is different. What works for one person may not work for another. So it's always a good idea to consult with a healthcare professional before making significant changes to your diet, exercise, or your health routines, especially if you have underlying medical conditions. I understand how frustrating constipation can be, and I'm here to offer solutions that are not only effective but also natural and sustainable. Let's dive deep into the ultimate guide to personalized DIY home remedies for effective and long-term constipation relief. Get ready to control of your gut health and start living a more comfortable, vibrant life. Remember, it's all about finding what works best for you and making it a sustainable part of your daily routine. Stick around and let's dive into this ultimate guide to personalized DIY natural home remedies for immediate and long term constipation relief. Now, let's talk about chapter number 1, why your natural remedies are not working for you. So, we listen to many people and read many things. And sometimes when you look at YouTube videos and even content, there are mostly generic advices. And generic advice do not work because everybody is different, their body is different. More importantly, the root causes are different. Hence, just taking a broad strokes and generic advices and generic natural remedies and trying to incorporate in our life, and then we do not see the change that we desire for a long period of time, and we really get frustrated about it. So, are you frustrated with home remedies that's not working for you? So, in this chapter, we are going to figure out why it's not working and give you some advice what you can do. And third, we are going to talk about brief overview of how to personalize it. So let's start with examples that why it may not be working. The number one common home remedy that we use for quick relief is laxatives. And we may be using laxatives for short term, mid term, and long term. And after a certain period of time, we get dependent on it and it's not useful anymore. For example, there are different types of laxatives. One, if we lack fiber, bulk forming would be useful because it'll form a certain give a shape to the stool. If we want to use as a stool softener, the osmotic laxative is useful. And sometimes we don't have the urge to go, the stimulant laxative would be really useful. And understanding when to use and how to use is important. So in this scenario, if you lack stimulant, if you need a stool softener, and if you require bulk, the laxative may be useful. But your root cause may be entirely different. Your root cause could be because we talked about that in our previous episode as well. There may be different types of constipation: normal transit constipation, slow transit constipation, constipation due to structural issues, neurological issues, and psychological issues. And now, if for normal transit, it may work. For slow transit or other structural issues, it may not work. No matter how much fiber you take or no matter what kind of laxative that you take, it may not work. And even within laxative, if you don't have the urge to go at all, there is no stimulation at all, using this osmotic stool softener or bulk forming will not work at all. So hence, understanding what's the root cause is super important. Let's talk about second common example is fiber. People often take, if you are constipated, maybe you lack fiber in your diet. Hence, the bulk forming laxative or fiber supplements such as psyllium husk or fiber intake upgrade using food may be suggested, but after taking a fiber for so long, it may not work. The following reason it may not work is, again, it may not be due to your diet predominantly. It may be due to other issues as well, such as medication issues, structural issues, medication side effects, the pelvic floor function dysfunctions, some motility issues, and so on. If you are getting constipation because of that, no matter of fiber will be useful. Even within fiber, there are soluble fibers and insoluble fibers. If you're just simply taking insoluble fibers when actually you need soluble factors to soften your stool, that may not be working as well. So even in fiber case, let's say your fiber is the right natural remedy, but even in that, how much to take, when to start taking, and if you are not going to supplement pair the fiber supplements with increase in water intake, it may still cause you constipation and even worsen it. So what that means is understanding the root cause is absolutely important. Why it's causing is simply listening to a generic advice and just start intaking the home remedy or implementing the home remedy may not work. And the third example is one of the reasons why we're often constipation is sedentary lifestyle. But we start exercising and we do not see the outcome. The exercise may be really, really useful when our chronic constipation is because of sedentary lifestyle. What that means is it increases the motility, increases transit from food from stomach to small intestines to large intestines and rectum. So that increases the speed through which the stool travels. But if our root cause is different, as in the fiber or the laxative, structural issues such as the pelvic floor dysfunction, the neurological issues because such as Parkinson's, other neurological conditions, genetic disorders which have a nerve damage, and so on. No matter how much we exercise, it may not work. And also, exercise alone is not enough. We have to work on the, again, diet. And if the anxiety, depression is causing exercises, causing chronic constipation, then it may have to add meditations and so on. Therefore, enough, all of these three examples, laxative, fiber, and exercise, are common generic natural remedies given to constipation patients. But if these things are not working for you, because you are not targeting the root cause. Hence, understanding the root cause is absolutely important. That's why we did a separate videos, deep dive into understanding root causes. We did an episode about everything that you need to know about constipation. We talk about how I became scientist of my own body and cured my constipation. And we talk about different tests, home tests, biomarkers, and clinical tests to require to diagnose the root cause of it. And again, there may be other reasons why you are constipated, which has nothing to do with the digestive system, but metabolic disorders, cardiological disorders, autoimmune disorders, endocrine disorders. These may also impact. So I highly recommend you to go through those episodes and figure out what's the root cause of your conditions. And then you can think about what's the home remedy that works for me. And then implement that, and that will give you more returns than just randomly picking something and hoping that it will work for you. Hence, personalizing it. The personalizing becomes so important. For example, if it's because of a travel, then when the travel triggers the constipation, then what is causing it? Is it because sedentary lifestyle? Is it because your sleep cycle changed? Is it because there is amount of stress? Is it because there's a food going along? That will help you personalize for travel. If you are pregnant, then obviously there may be another reasons, the hormonal reasons why you're constipation, and also structural reasons that why you're constipated. So there may be different reasons. If you are post-surgery, then lack of sedentary, or if you are having diagnosed something and you start taking medication, that is causing chronic constipation. Here, and also even the lifestyle, diet, and psychological reasons, parsing through different root causes and understanding, okay, what's the root cause and what will work for me, and then start trying the home remedies one by one for these conditions. And that will increase the probability that home remedy will work for you. And obviously, people are in different spectrums of it. Sometimes some people have very low severity, some who have medium and very high severity, who have enough pain, may also need the clinical intervention. And for that, I advise you to discuss with your clinicians about it. But in general, to recover, to prevent, to calm your pain, and to restore and elevate your life, home remedies are extremely useful. It's about knowing what's the root cause, what are the home remedies that target those root causes, and how you can personalize it. We are going to talk about all of these things in details in the following chapter. So before we move on to the home remedies part, we have to understand about our body as well. So next chapter is about understanding how different organs, head to toe, from mouth, stomach, liver, small intestine, large intestines, gallbladders, and so on, can affect constipation, and also the deficiencies in vitamins, enzymes, different microbes can also impact chronic constipation. So even understanding these will help us understand, okay, what are the home remedies that's going to target, whether if my constipation starts because of my psychological issues in my head, in my mouth, in my stomach, then we start incorporating or planning or designing our home remedies to target our root cause. Let's move on. Now let's talk about chapter 2, how your body contributes to constipation. If you are struggling with chronic constipation and feel like nothing is working for you, you are not alone. Today, in this chapter, we are diving deep into how different organs and systems in your body contribute to this condition. By understanding these factors, you can better identify the root causes of constipation and find personalized, effective, natural DIY home remedies that target those specific issues. Let's get started. By the end of this video, you will understand how various organs, systems contribute to constipation. You'll have a clear path to finding personalized solutions that actually work. In this chapter, we will cover the role of nervous system, including autonomic central nervous system, as well as psychological and behavioral factors. So let's start with that often flies under the radar, the autonomic nervous system, ANS. This system controls involuntary bodily functions, including digestion. It has two parts, sympathetic and parasympathetic. The sympathetic system slows down digestion while parasympathetic system speeds it up. And when there is an imbalance, such as chronic stress activating the parasympathetic system, it can slow bowel movements, that leading to constipation. Disorders like autonomic neuropathy, often seen in diabetes, can damage these nerves and disrupt bowel function. Addressing stress through techniques like yoga and meditation and managing conditions like diabetes can significantly improve bowel function. If you identify that if your constipation is related to ANS issues, focusing on stress management and overall nervous system health can be crucial. Next, let's talk about central nervous system, CNS, which includes brain and spinal cord. Neurological disorders like Parkinson's disease, multiple sclerosis, and spinal cord injuries can interfere with signals between brain and gut. These conditions can slow down intestinal motility, making it harder for stool to pass. If you have neurological condition, working with your healthcare provider to manage it and adopting home remedies that enhance neurological health can make a significant difference. Next, let's talk about psychological and behavioral factors. Stress, anxiety, and depression can significantly impact gut health. The gut-brain axis, a bidirectional communication system between the CNS and the gut, means psychological stress can slow down or disrupt bowel movements. Stress management techniques such as yoga, meditation, deep breathing exercises can alleviate constipation related to psychological factors. Addressing mental health with professional help can also lead to significant improvements. If stress and anxiety are contributing to your constipation, incorporating relaxation techniques into your daily routine can be a powerful remedy. Now we have explored how the nervous system affects constipation. Let's move on to digestive system and how it plays a crucial role. Let's start with section 1, mouth and chewing, the first step to preventing constipation. Digestion begins in mouth. Proper chewing breaks down the food into smaller particles, making it easier for the stomach and intestines to process. Inadequate chewing can lead to larger food particles entering the digestive tract, which can slow down digestion and lead to constipation. Taking time to chew food thoroughly is a simple but effective way to improve your digestion and prevent constipation. If your chewing habits are contributing to constipation, focus on mindful eating and chewing thoroughly can help. Now, section 2, stomach issues, how delayed gastric emptying causes constipation. The stomach plays a critical role in breaking down food with acids and enzymes. Delayed gastric emptying or gastroparesis can slow down the movement of food from stomach to the intestine. This delay can cause bloating and constipation. Conditions like diabetes and certain medications can lead to gastroparesis. Managing these conditions and adjusting medications can help improve gastric emptying. And if you suspect your stomach issues are the root cause, addressing gastroparesis through diet modifications and medical management can be beneficial. Section 3, small intestine, about nutrient absorption and constipation. The small intestine continues to digest and absorb nutrients from food. When the small intestine is not functioning properly, it can lead to constipation. Conditions such as small intestinal bacterial growth, SIBO, can cause bloating and delay movement through the intestines. Treating SIBO with antibiotics or probiotics can alleviate these symptoms. If your small intestines isn't absorbing nutrients effectively, Focusing on gut health through probiotic and balanced nutrition can improve your symptoms. Now let's talk about large intestines in section 4 and how it affects stool formation. The large intestine or colon absorbs water and forms stool from indigestible food matters. If the colon moves too slowly, too much water is absorbed, resulting in hard or dry stools. Conditions like irritable bowel syndrome and colonic inertia can affect colonic motility and lead to constipation. Increasing fiber intake and staying hydrated can help improve colonic function. If the large intestine is the issue, increasing fiber and hydration along with regular physical activity can help improve bowel movements. Section 5, let's talk about liver, gallbladder, and bile ducts, the role of bile in constipation. The liver produces bile, which is stored in a gallbladder and released into small intestine to help digest fats. If there is a problem with bile production or flow, such as the gallstone or bile duct obstruction, it can hinder fat digestion and lead to poor stomach or stool formation and constipation. Treating these conditions can improve bile flow and digestion. If your constipation is related to bile flow or production, focusing on liver and gallbladder health through dietary changes and possibly medical treatment can help. So, with a good understanding of digestive system, now let's explore the endocrine system and its impact on chronic constipation. Let's start with segment 3, endocrine system, and section 1, thyroid gland, hypothyroidism, and constipation. The thyroid gland produces hormones that regulate metabolism. Hypothyroidism or an underactive thyroid can slow down metabolic processes, including bowel motility, leading to constipation. If you suspect thyroid issues, a simple blood test can diagnose hypothyroidism, and thyroid hormone replacement therapy can alleviate constipation. If hypothyroidism is your root cause, managing it through medication and regular monitoring can significantly improve your bowel movements. Now, let's talk about the role of pancreas in endocrine system, which produces digestive enzymes, and talk about their importance. The pancreas produces digestive enzymes that break down food in the small intestine. Insufficient production of these enzymes, such known as exocrine pancreatic insufficiency, can hinder digestion and lead to constipation. So, pancreatic enzyme replacement therapy can help improve digestion and relieve constipation. If pancreatic enzyme insufficiency is affecting you, enzyme supplements and a diet tailored to your needs can provide relief. Next, let's look at circulatory system and its impact on constipation. That's segment 4 for us. And in that segment, let's talk about section 1, which is blood flow to intestine, the heart of the problem. So proper blood flow to the intestine is crucial for their function. Poor circulation, often due to cardiovascular diseases or conditions like mesenteric ischemia, can impair intestinal function and lead to constipation. Ensuring good cardiovascular function through diet, exercise, medication can help maintain proper blood flow and intestinal function. If poor blood flow is contributing to your constipation, improving your cardiovascular health can make a significant difference. Finally, let's examine the immune system's role in constipation, which is our segment 5. The inflammatory diseases can cause constipation. The immune system protects the body from infections and other foreign substances. However, chronic inflammation in the intestines, such as Crohn's disease or ulcerative colitis, which is also part of IBD, can alter bowel function and contribute to constipation. So managing these inflammatory diseases with medication, diet, and lifestyle changes can help improve bowel movement and bowel function and reduce constipation. If inflammation is the root cause, working with healthcare provider to manage it effectively can lead to better bowel health. So to conclude this chapter, understanding how different organs and systems contribute to constipation can help identify the root cause and determine the most effective treatments. By addressing the issues in nervous system, digestive system, endocrine system, circulatory system, and immune system, you can find personalized solutions to relieve and prevent constipation. And also you can find what's the natural DIY home remedies that work for you when you understand the root causes. And also, always consult with the healthcare provider to ensure that you are addressing the correct underlying causes. Now, let's dive into how insufficient nutrients, vitamins, enzymes, and microbes and hormones can impact constipation. So, understanding these factors can help us identify the root cause of our constipation and find personalized, effective, natural DIY home remedies that target those specific issues. Let's get started. In this chapter, we'll cover 5 different segments. Number one segment is we talk about essential nutrients and their role in constipation. Segment two is the importance of vitamins for gut health and constipation. Segment three is how digestive enzymes influence bowel movements. Now, segment four is the role of microbes in maintaining regularity and constipation. And finally, segment five will talk about the roles of hormones in constipation. So we'll dive deep into each of these areas to help you understand how they contribute to constipation. Let's begin. First, let's talk about essential nutrients. These are vital for our overall health and play a significant role in maintaining regular bowel movements. Let's begin with macronutrients. We'll discuss about two: fiber and water. Fiber is crucial for adding bulk to our stool and helping it pass through the intestines. There are two types of fiber: soluble and insoluble. Soluble fibers dissolve in water to form a gel-like substance. It helps to soften the stool and make it easier to pass. Foods high in soluble fibers include oats, beans, lentils, and some fruits like apples and oranges. Insoluble fibers does not dissolve in water. Instead, it adds bulk to the stool and helps it move through the intestine or digestive system more quickly. Whole grains, nuts, vegetables, and wheat bran are excellent source of insoluble fiber. Both types of fiber are important, so it's essential to include a variety of fiber-rich foods in the diet. Next, water. Obviously, hydration is key. Water helps dissolve fats and fiber, make it stools soft and easier to pass. When we are not adequately hydrated, our body draws water from stool to maintain hydration, which result in hard, dry, and difficult to pass stool. So we must aim to drink at least 8 glasses of water a day and more if we have very active or live or we live in a hot climate. Next, let's talk about essential minerals. We are going to talk about 4 here: magnesium, calcium, potassium, and iron. Let's start with magnesium. Magnesium plays a critical role in the digestive system by relaxing the muscles in the intestinal wall and drawing water into the intestines. This helps soften the stool and stimulate bowel movements. Foods rich in magnesium include green leafy vegetables, nuts, seeds, whole grains, and legumes. So magnesium supplements can also be used, but it's essential to consult your healthcare provider to determine the right doses for you. Next, calcium. Calcium is essential for muscle contractions, including those in the intestines. However, too much calcium, especially from the supplements, can lead to constipation because it can slow down the intestinal motility. Dairy products, leafy green vegetables, and fortified foods are good source of calcium. If you are taking calcium supplements, ensure you balance them with adequate magnesium and fiber intake. Next, talk about potassium. Potassium is vital for maintaining normal muscle contractions in the digestive tract. It helps regulate the fluid balance in our body, which is crucial for keeping stools soft and obviously easy to pass. So potassium-rich foods include bananas, oranges, mangoes, tomatoes, potatoes, and spinach. A deficiency in potassium can lead to weak intestinal muscles and constipation. Finally, iron. So iron is necessary for red blood cell production, but iron supplements can cause constipation as a side effect. This happens because iron can slow down the digestive process and make stools harder. If you are taking iron supplements, increase your fiber, and stay well hydrated to help mitigate this effect. Obviously, the natural source of iron include red meat, beans, lentils, fortified cereals, and spinach. Now let's talk about other essential nutrients such as probiotics, prebiotics, omega-3 fatty acids, and amino acids. Let's start with probiotics. Probiotics are live bacteria that help maintain a healthy gut microbiome, which is crucial for proper digestion and regular bowel movements. They help balance the gut flora by increasing the number of beneficial bacteria, which can improve stool consistency and reduce the time it takes for food to travel through the intestines. So, probiotic rich foods include yogurt, kefir, sauerkraut, kimchi, and other fermented food. There are supplements also available, but choose one with a variety of strains for the best effect. So, in the fourth section of this particular chapter, we are going to talk about different microbes in more details. So, to wait for that, or you can skip to that section directly. Next, let's talk about prebiotics. So, prebiotics are non digestible fibers that serve as food for beneficial bacteria. They maintain a healthy gut environment and improve bowel regularity by promoting the growth of these bacteria. Foods high in prebiotic include garlic, onions, leeks, asparagus, banana, whole grains. So, including prebiotic rich food in our diet can enhance the effectiveness of probiotics. So, simply taking probiotic without prebiotic will not help because we'll essentially starving our gut bacteria without providing the food for them. Next, let's talk about omega-3 fatty acids. So, omega-3 fatty acids have anti-inflammatory properties that support overall gut health and can help prevent constipation. They can reduce inflammation in the digestive tract and improve motility. So, good sources of omega-3 fatty acids include fatty fish like salmon, mackerel, and sardines, as well as flax seeds, chia seeds, and walnuts. Finally, amino acids. Amino acids are the building blocks of proteins that support the repair and maintenance of the intestinal lining. They play a role in production of digestive enzymes and neurotransmitters that regulate gut motility. So, adequate protein intake in form of variety of sources, including meat, dairy, eggs, legumes, and nuts, ensures you a complete profile of amino acids essential for gut health and consequently preventing constipation. So, understanding the role of these essential nutrients can help potential identify deficiencies that may contribute to constipation. So, addressing these deficiencies through a balanced diet, adequate hydration, and possibly supplement can form an effective and personalized approach to managing and preventing constipation. Next, let's talk about importance of vitamins for constipation. Let's explore the role of vitamins in constipation. Vitamins are essential for various bodily functions, including digestion. A deficiency or excess of these vitamins can lead to issues such as impaired gut motility, weakened mucosal health, and overall digestive discomfort. So let's start with key vitamins, that is vitamin D, vitamin B1, vitamin B2, and so on. And we'll go comprehensive about all the vitamins that essentially impact constipation. So let's begin with vitamin D. Vitamin D regulates calcium absorption and supports immune function. Low levels of vitamin D have been linked to various gastrointestinal issues, including constipation. This is because vitamin D receptors are found in colon, and their activation helps in regulation of gut motility. On the other hand, excessively high levels of vitamin D can lead to hypercalcemia, which may also cause constipation. So, the source of vitamin, we must get enough sunlight exposure or we must take supplements. I live in Boston, so which has limited sunlight, so I take vitamin D supplements. But obviously, always consult with a healthcare provider for appropriate doses. Next is vitamin B1, thiamine. Thiamine is essential for nerve function and energy metabolism. It plays a crucial role in proper functioning of the enteric nervous system, which regulates gut motility. A deficiency in thiamine can lead to conditions such as beriberi, which affects the cardiovascular and nervous systems and indirectly influence gut motility, potentially leading to constipation. While toxicity from excess thiamine is rare due to its water-soluble nature, it's important to ensure that adequate intake through foods like whole grains and legumes and nuts. Next, let's move on to vitamin B2, riboflavin. Riboflavin is important for energy production and maintaining mucosal health in digestive tract. It helps in breakdown of carbohydrates, proteins, and fats, which is essential for normal digestive processes. Deficiency in riboflavin can cause issues like sore throat, swelling of mucous membranes, and anemia, all of which can indirectly affect digestion. Conversely, high levels typically don't harm due to its water-soluble nature. Food rich in riboflavin includes milk, eggs, green vegetables, and fortified cereals. Vitamin B3, niacin. Niacin helps maintain healthy mucous membranes and can influence digestive function. So, adequate levels of niacin, vitamin B3, are necessary for proper digestive enzyme function, which aids in breakdown and absorption of nutrients. Deficiency can lead to pellagra, which causes gastrointestinal disturbances, among other symptoms. Excessive niacin can cause flushing and liver damage. So, sources of niacin include poultry, fish, lean meats, nuts, and legumes. So, vitamin B5, pantothenic acid. So, pantothenic acid supports energy metabolism and synthesis of coenzyme A, which is crucial for digestive processes. Coenzyme A is involved in the synthesis and oxidation of fatty acids, which are essential for maintaining the health of the digestive tract. So, deficiency is rare, but can lead to symptoms like fatigue and digestive issues. So, pantothenic acid toxicity is also rare. You can find pantothenic acid in a variety of foods, including egg, fish, poultry, whole grains, and avocados. Next, vitamin B6, pyridoxine. Vitamin B6 is essential in protein metabolism and neurotransmitter synthesis, which affect gut-brain communication. So it helps convert tryptophan into serotonin, or neurotransmitter that regulates bowel movement. Deficiency can cause symptoms like irritability, depression, and weakened immune function. And excessive vitamin B6 can cause nerve damage. So food rich in vitamin B6 include poultry, fish, potatoes, chickpeas, bananas, and fortified cereals. Vitamin B7, biotin. Biotin supports the health of digestive system and include gut flora. It is involved in the synthesis of fatty acids and glucose, which are essential for maintaining energy levels and overall digestive health. Deficiency can cause symptoms like hair loss, skin rashes, and neurological issues. High levels are typically not harmful, so biotin is found in eggs, nuts, seeds, and certain vegetables like sweet potatoes. Vitamin B9, folate. Folate is essential for cell growth and repair, including the cells lining the digestive tract. Adequate folate levels ensure proper functioning of the gastrointestinal system, so deficiencies can cause megaloblastic anemia and gastrointestinal disturbances. So excessive folate can mask vitamin B12 deficiency, leading to neurological damage. So leafy green vegetables, legumes, nuts, and fortified cereals are excellent source of folate. So vitamin B12, cobalamin. So vitamin B12 is critical for nerve function and red blood cell production. Of deficiency in vitamin B12 can cause neurological issues, impaired nerve function, and that can slow down bowel motility. So high levels of B12 are generally considered safe. Foods rich in vitamin B12 includes meat, dairy products, and some fortified cereals. This is special consideration for vegetarians and vegans because B12 is only found in animal products. So if you're vegetarian and vegan, you should consider vitamin B12 supplements. I know that because my wife is a vegetarian, and once when we checked her vitamin B12 levels, it was dangerously low. And we learned from a doctor that vitamin B12 can only be found in the animal products. So she started taking B12 supplements. Now she's fine. So take a note, vegetarians and vegans. Vitamin C. So vitamin C enhances iron absorption and supports immune function. High doses of vitamin C can act as mild laxative. So if you take orange juice in the morning and you have the urge to go, this is the reason why, because orange juice has very good content of vitamin C. So vitamin C helps soften stools and obviously promote bowel movements. Deficiency can lead to scurvy, which includes symptoms like bleeding gums and fatigue. High levels can cause gastrointestinal disturbances such as diarrhea. So citrus food, strawberries, bell peppers, and broccoli are excellent source of vitamin C. Next, let's talk about vitamin E. So vitamin E protects cell membranes and support immune function. It helps in maintaining the integrity of the cell linings in the digestive tract, which is vital for overall gut health. So deficiency is very rare but can cause neurological problems. So excessive vitamin E can interfere with blood clotting. Food rich in vitamin E includes nuts, seeds, spinach, and broccoli. So vitamin K. Vitamin K is important for blood clotting and bone health, with emerging evidence suggesting a role in gut health. It helps to maintain the integrity of gut lining and supports the overall digestive process. Deficiency can lead to bleeding disorders, while high levels are generally not considered harmful. Again, green leafy vegetables such as kale, spinach, broccoli are good sources of vitamin K. Understanding the roles of these vitamins as well as consequences of both deficiencies and excesses can help identify potential issues that may contribute to constipation. So, addressing these imbalances through a balanced diet, adequate hydration, and possibly supplements can form a part of an effective personalized approach to managing and preventing constipation. So, in the home remedies section as well, most of these can be gotten through a balanced diet. The reason why we either have deficiencies or excesses because most of the people in the world now consume processed food, and they may not have all the nutrients that require macro, minerals, and micronutrients and vitamins. Hence, we are going to this one by one to understand their role. And when we understand the role, if we identify the deficiency or excess, then we can take the home remedies that directly target either deficiency, or excess. Next, we're going to talk about digestive enzymes, how it influence bowel movement. Now, let's dive into digestive enzymes. So, enzymes are crucial for breaking down food into nutrients, and any deficiencies in these enzymes can significantly impact digestion and it contribute to constipation. So, let's start with key enzymes. Number one, amylase. Amylase is responsible for breaking down carbohydrates into simple sugars, primarily glucose, which the body uses for energy. This process begins in the mouth with the salivary amylase and continues in the small intestines with pancreatic amylase. A deficiency in amylase can lead to undigested carbohydrates reaching the colon, where they can ferment, causing bloating, gas, and constipation. So, ensuring adequate amylase activity is essential for smooth digestion and preventing these uncomfortable symptoms. Next, protease. So protease break down proteins into amino acids, which are crucial for various bodily functions, including muscle repair and immune response. This enzyme is produced in the stomach called pepsin, and pancreas, trypsin and chymotrypsin. So inadequate protease activity can result in undigested proteins reaching the large intestine, leading to digestive discomfort, including bloating and constipation. So ensuring sufficient protease activity helps in efficient digestion of proteins and prevention of these issues. Number third, lipase. Lipase is or lipase, however you want to pronounce it. So lipase is responsible for breaking down dietary fats into fatty acids and glycerol, which can be absorbed by the intestines. This enzyme is produced in the pancreas and works in the small intestine. A deficiency in lipase can cause fat malabsorption, leading to steatorrhea, greasy stool, bloating, and constipation. So, if you see, that's the reason why Bristol stool charts is very useful. If you find greasy stool, you can understand that there is a malabsorption of the fat, which is deficiency in lipase. So maintaining adequate lipase levels is essential for proper digestion of fats and overall digestive health. Next is lactase. So lactase breaks down the sugar, which is called lactose. The sugar found in the milk and dairy products include glucose and galactose. This enzyme is produced in the small intestine, so lactose intolerance resulting from the deficiency in lactase can cause bloating, gas, and constipation. So when undigested lactose reaches the colon and ferments. So identifying and managing lactose intolerance is crucial for preventing these digestive issues. And many large percentage of population in the world have lactose intolerance because their body cannot produce lactase. Next is cellulase. Humans do not naturally produce cellulase, an enzyme that breaks down cellulose, a major component of dietary fiber found in the plant cell walls. However, cellulase can be obtained from dietary sources like fermented foods or supplements. So these enzymes help break down fiber, aiding in digestion and preventing constipation. So including cellulase in your diet through these sources can help fiber digestion and bowel regularity. So the trillions of microbes that are found in gut microbiome can help produce the enzyme cellulase, which breaks down the cellulose, and that essentially helps in our bowel regularity. Next is sucrase. So sucrase is responsible for breaking down sucrose, which is table sugar, into glucose and fructose, which are absorbed by the intestines. This enzyme is produced in the small intestine. A deficiency in sucrase can lead to undigested sucrose reaching the colon, causing bloating, gas, and potentially constipation. Ensuring adequate sucrase activity is vital for proper digestion of sugars and preventing digestive discomforts. Next, maltase. Maltase breaks down maltose, a sugar found in malt products, into two glucose molecules. This enzyme is produced in the small intestines again. Without sufficient maltase, maltose remains undigested and can cause digestive discomfort, including bloating and constipation. Maintaining adequate maltase levels is important for efficient digestion of maltose and overall digestive health. Next is peptidase. Peptidase break down peptides, which are small chains of amino acids, into individual amino acids that body can absorb and use. These enzymes is this enzyme is crucial for complete digestion of protein. A deficiency in peptidase can lead to incomplete proper digestion, resulting in digestive issues, obviously bloating and constipation. Therefore, ensuring sufficient peptidase activity helps in thorough digestion of proteins and prevention of these symptoms. Next is phytase. So phytase breaks down phytic acid, an anti-nutrient found in seed, nuts, grains, and legumes, which binds the essential minerals and reduce their absorption. This enzyme helps release these bound minerals, improving their absorption and supporting overall digestive health. So, including phytase-rich foods or supplements in your diet can enhance mineral absorption and prevent constipation. So, phytic acid, for example, you can be found in almonds, And one of the ways to reduce phytic acid in almonds is to soak it overnight and peel the cover and eat it. So that will reduce the phytic acid. Finally, the last one is alpha galactosidase. Alpha galactosidase breaks down complex carbohydrates found in legumes and cruciferous vegetables into a simpler sugars that are easy to digest. These enzymes helps reduce gas and bloating, and which can contribute to constipation. So taking alpha galactosidase supplements, especially when consuming gas-producing foods, can improve digestion and prevent constipation. So, understanding the role of these enzymes can help in identifying potential deficiencies that may contribute to constipation. And obviously, addressing these deficiencies through dietary changes or supplements can form a part of an effective, personalized approach to managing and preventing constipation. And we'll talk about home remedies, which are DIY and natural remedies, in the following chapter. But understanding these deficiencies are extremely useful because that can identify our root cause, and then home remedies can target those root cause. Next, let's talk about our fourth segment, the role of microbes in constipation. So these microorganisms play a vital role in maintaining regularity and overall gut health. A balanced gut microbiome is essential for efficient digestion and preventing constipation. In future episode, we will do a masterclass in gut microbiome. For now, we'll just briefly walk through the brief overview of what are different types of microbes that impact our constipation, and those microbes can be found in different parts of the body. And one confession, pronouncing these microbes are extremely challenging, and I'll do my best. Pardon me if I make mistake in the pronunciation. The microbe we are talking about is Staphylococcus epidermidis. This microbe is normally harmless and part of skin's natural flora. However, if the skin is broken, it can cause infections that can lead to systemic inflammation, and this inflammation can indirectly affect gut health by disrupting the body's overall balance. And next one in skin is Cutibacterium acnes. So primarily associated with acne, this bacterium can cause inflammation in the skin, and systemic inflammation from skin infection can seep into overall influence in health, including the digestive system, so potentially impacting the gut health. Next, let's move on to the mouth. So we're going to talk about three different types of microbes found in the mouth. One is Streptococcus mutans. This bacterium contributes to dental plaque and cavities, and oral infections caused by Streptococcus mutans can lead to, again, systemic inflammation that can influence gut health through oral gut access. Second one is Lactobacillus spp. So beneficial bacteria in the mouth that can help oral health and begin the breakdown of carbohydrate, and it aids in digestion. So healthy oral microbiome can positively impact gut health. Number 3 is Porphyromonas gingivalis, associated with periodontal disease. So chronic oral inflammation caused by this bacterium can cause gut health via systemic inflammatory pathways, contributing to digestive issues. Next is small intestines. We just learned in the previous chapter that there are a lot of enzymes the small intestines produce that play a role in break down fats, proteins, carbohydrates, and so on. And if those enzymes are not produced, that impact in indigestion, causing bloating, constipation, and so on. Similarly, there are different microbes that live in small intestines that help in digestion as well. So we're going to walk through three. Number 1 is Lactobacillus spp. These probiotics produce lactic acid, helping to maintain the acidic environment in the gut that inhibits harmful bacteria and produce gut motility. This prevents constipation by ensuring a healthy gut bacteria flora. Second one is Bifidobacterium spp. So these bacteria produce short chain fatty acids, SCFAs, such as acetate, propionate, and butyrate, which are essential for gut health and regularity. So they help nourish colon cells and promote bowel movements. The third one is Escherichia coli, non-pathogenic. So that is non-pathogenic E. coli. The normal strains of E. coli assist vitamin K production and help maintain gut balance. However, overgrowth of pathogenic strains can lead to dysbiosis and, again, constipation. So in large intestines, there are many microbes. We're going to talk about 5, starting with Bacteroid spp. These bacteria break down complex carbohydrate and proteins, producing short-chain fatty acids that nourish the colon cells and stimulate bowel movements. They are crucial for maintaining a healthy gut environment. Second one is Firmicutes. This group includes many fiber fermenting bacteria that produce short-chain fatty acids, which are vital for maintaining colon health and promoting regularity. A balance between Firmicutes and bacteroids is essential for overall gut health. Third one is Akkermansia muciniphilia. Akkermansia muciniphilia. This bacterium plays a key role in maintaining the integrity of the gut lining and regulating the mucus production. It promotes healthy bowel movements by ensuring the gut lining remains intact and functional. The fourth one is Faecalibacterium prosnithizi. Very difficult to pronounce, I must say. So known for anti-inflammatory properties, this bacterium produces butyrate, a short-chain fatty acid that supports colon health and prevents constipation by promoting a healthy anti-inflammatory response in the gut. Finally, the fifth one, Ruminococcus spp. These bacteria ferment dietary fiber into short-chain fatty acids, contributing to gut health and regular bowel movements. They play a crucial role in digestion of complex carbohydrates and production of beneficial compounds. So, we live in symbiotic relationship with the microbes that are found in different parts of the organs. An imbalance in these things can cause dysbiosis, and that can lead to constipation. Dysbiosis can lead to systemic inflammation, and that can cause to not only the chronic constipation but also various other chronic diseases. So understanding the microbiome in different parts of our body. So skin, there is a skin gut axis, there is oral gut axis, there is obviously a lot of microbes that live in small intestines and large intestines, produce essential enzymes, short chain fatty acids, and so on. That's absolutely essential for proper functioning of not only digestive function but all the other body functions as well. So understanding the role of these microbes can help identify the imbalances in the gut microbiome that contribute to our constipation. So I include fermented food and different probiotic, prebiotic. We are going to talk about all of those in the home remedies section. For here, what we need to understand is addressing these imbalances through diet, probiotic, lifestyle changes can form part of a very effective and personalized approach to managing and preventing chronic constipation. Finally, now let's explore how hormones impact constipation. Hormones play a crucial role in obviously regulating various bodily functions, including digestion and bowel movements. So understanding how hormonal imbalances can lead to constipation can help us identify root cause and find effective solution. Let's start with thyroid hormones. Thyroid hormones T3 and T4 Thyroid hormones, primarily T3, triiodothyronine, and T4, thyroxine, regulate metabolism and overall bodily functions. Hypothyroidism, a condition where the thyroid gland produces insufficient thyroid hormones, can slow down metabolism and decrease bowel motility, leading to constipation. If you suspect thyroid issues, it's essential to get your thyroid levels checked and consult with a healthcare provider. Next section is reproductive hormones. We have two hormones here, estrogen and progesterone. So estrogen regulates reproductive and sexual functions. High levels of estrogen, such as during pregnancy or menstrual cycles, can slow down the digestive system, causing constipation. This is because estrogen can relax the smooth muscles in the intestines, reducing bowel motility. Progesterone prepares the body for pregnancy and regulates the menstrual cycle. Increased progesterone levels during pregnancy can further relax the smooth muscles of the intestines, leading to a slower bowel movements and constipation. So managing diet and hydration level can mitigate these effects. Section 3 about stress hormones. Cortisol. So cortisol is a stress hormone that manages the body's response to stress and regulates metabolism. High cortisol levels due to chronic stress can negatively impact the digestive system and potentially leading to constipation. Obviously, the stress management techniques such as yoga, meditation, deep breathing exercises can reduce cortisol levels and improve gut motility. And section 4 is about insulin and blood sugar regulation. So insulin regulates the blood sugar levels. Insulin resistance or diabetes can affect the gut motility and contribute to constipation. So maintaining stable blood sugar levels through a balanced diet and regular exercise can help manage constipation related to insulin imbalances. Next, section 5, mineral low corticoid hormones, which is aldosterone. So aldosterone regulates sodium and potassium imbalance and blood pressure. High levels of aldosterone can lead to fluid retention, which might reduce water content in the stool, causing constipation. So monitoring electrolyte levels and staying hydrated can help alleviate constipation related to aldosterone imbalances. Next is calcium regulation hormones, parathyroid hormones. So parathyroid hormones regulate calcium levels in the blood. High levels of PTH, parathyroid hormone, can increase calcium levels, which can contribute to constipation. Ensuring balanced calcium intake and addressing any underlying parathyroid issues are crucial for maintaining digestive health. Finally, the last hormone we're going to talk about is sleep hormones. Melatonin regulate sleep-wake cycles and affect the gut motility. Changes in melatonin levels, especially during the night, can impact bowel movements. Maintaining a regular sleep schedule and maintaining light exposure can regulate melatonin levels and improve constipation. So we're going to also talk about the circadian rhythm in the future, but melatonin is hormone regulates the sleep-wake cycle and also regulates the circadian rhythm. So managing that, balancing that melatonin is essentially important for maintaining gut motility. So in conclusion, hormone imbalances can significantly impact digestion and contribute to constipation. So by understanding the roles of hormones such as thyroid hormones, estrogens, progesterones, cortisol, insulin, aldosterone, parathyroid hormones, and melatonin, you can better identify the root cause of your constipation. In this chapter, we explored how various factors impact constipation. We talk about essential nutrients, fiber and water, minerals such as magnesium, calcium, potassium, and iron that play key roles in digestion and bowel movement. And we also talk about other nutrients, probiotic, prebiotic, omega-3 fatty acids, amino acids. And then we talk about vitamins. So vitamin D, B complex, B1, B2, B3, B5, B6, B7, B9, B12, and vitamin C, E, and K. We talk about those, how they are crucial for gut health and regular bowel movements. In third segment, we talk about digestive enzymes such as amylase, protease, lipase, lactase, cellulase, sucrase, maltase, peptidase, phytase, and alpha galactosidase that help break down and absorb nutrients. In segment 4, we talk about role of digestion. We talk about beneficial microbes in skin, mouth, small intestines, and large intestines that are essential for maintaining healthy gut and bowel movements. And finally, in segment 5, we talk about how hormones impact constipation. We talk about thyroid hormones, T3 and T4, reproductive hormones, estrogens and progesterones, stress hormones such as cortisol. We talk about insulin. We talk also about aldosterone, parathyroid hormone, and finally, we talk about melatonin, which is a sleep hormone. With this chapter, we conclude this segment about how different nutrients, lack of nutrients, deficiency in nutrients, vitamins, enzymes, microbes, and hormones can impact constipation. And when we understand these factors, we can understand the root cause and if the deficiencies or excesses are causing that. And then we can talk about DIY natural home remedies that target these deficiencies or excesses. Stay tuned. In our previous chapter, we explored how insufficient nutrients, vitamins, enzymes, microbes, and hormones can impact constipation. Understanding these factors is crucial, but what's even more important is knowing how to personalize home remedies to target those root causes effectively. If you have been struggling with constipation and feel like nothing seems to work, you are not alone. Many people turn to generic home remedies only to find little or no relief. The key to effective treatment lies in personalization. We have developed a special framework called Miracle, Miracle, to guide you through this process. Miracle stands for motivation, identifying root causes, remedy by demographics, assess body type, capability and opportunity, local and seasonal availability, and evaluate affordability. This comprehensive approach ensures that every aspect of your health and lifestyle is considered. In the next few minutes, I'll walk you through each step of Miracle Framework. We'll discuss how to assess your motivation, identify root causes of your constipation, and tailor remedies based on your demographics and body type, and make sure the remedies are practical and affordable for you. By the end of this video, you'll have a clear understanding of how to create a personalized plan to effectively manage your constipation. Are you ready to take control of your digestive health and find the relief that you have been looking for? Let's get started with the first step of our Miracle Framework, motivation. Our first step in the Miracle Framework is motivation. Personalizing your home remedies starts with understanding your motivation levels, because your willingness to make changes is the foundation for your success. Have you ever started a new diet or exercise plan and only to give up a few weeks later? It's a very common experience. I have dropped off my exercise plan or diet plan because we rely too much on motivation, because motivation can be fleeting. So when it comes to managing constipation, building consistent habit is the key. So ask yourselves, why do you want to overcome constipation? Maybe it's to feel more comfortable and confident, to improve your overall health, or simply to enjoy life without constant discomfort. In my case, I have desire to be an entrepreneur, creator, and helper for other people, but my life was getting consumed by constant worry from constipation, and I refused to live a life like that. Hence, I decided to make a change. And now, after a couple of years, I'm living constipation free. So, whatever your reason, it's important to keep in mind that as we build these new habits, that we can live constipation free. So, here are some practical tips to build habits and keep your motivation steady throughout your journey. Number 1, start small. Begin with manageable changes. For example, drink an extra glass of water each day or add one fiber food to your diet. Small and consistent actions build momentum. Number 2, create routine. Incorporate your new habits into your daily routine, like set reminders for drinking water, plan your meals, and schedule time for exercise. Consistency is the key. Number 3, track your progress. Keep a journal or use an app to monitor your symptom, diet, and any remedies that you're trying. Seeing progress, even small improvements, can be incredibly motivating. 4, find support. Share your journey with friends or family to join a support group. Having people to encourage you and share their experience can make a big difference. 5, celebrate small wins. Every step is a forward victory. Celebrate small achievements along the goes along the long way. For example, did you drink enough water today? Great job. Every positive action counts. Number 6, stay educated. Obviously, knowledge is power. The more you learn about your condition and how to manage it, the more empowered and motivated you will feel. Now, let's assess your current motivation level with a few questions. This will help you understand where you stand and how you need to stay on track. Here are some questions to ask yourself to gauge your motivation level. Number 1, why do you want to overcome constipation? Is it to improve your daily comfort, boost overall health, or something else? 2, how often do you feel frustrated by your constipation? Is it affecting your quality of life significantly? Number 3, are you willing to make small changes to your daily routine to improve your condition? Do you feel ready to start incorporating new habits? Number 4, do you have a support system to encourage you along the way? Are your friends or family aware and supportive of your journey? And 5, how confident are you in your ability to follow through with these changes? Do you believe that you can stick to a new routine? Answering these questions honestly can give you a clearer picture of your motivation levels. Remember, motivation is not a constant state, it fluctuates. But building habits create a foundation that keeps you moving forward even when motivation dips. So, what if you find your motivation is low? Here are some strategies to help you get started and keep going. Number 1, set clear and achievable goals. Break down your overall goal into smaller, manageable steps. For example, as I stated earlier, start by increasing your water intake by 1 glass a day. Number 2, find accountability partner. Find someone to check with regularly about your progress. This could be a friend, family member, or even an online support group. Number 3, visual reminders. Place reminders around your home or workspace. Sticky notes, phone alarms, or dedicated app that can help you keep on track. And 4, reward system. Reward yourself for achieving small goals. This can be something simple like a favorite treat or relaxing bath or a new book. I used to take a spoon of honey after I worked out, and that was my reward system. Number 5, professional guidance. If you are struggling, consider seeking help from a nutritionist, therapist, or healthcare provider who can offer you a personalized support or advice. So, motivation might get you started. It's the habit you build that will keep you going. If motivation is low, these strategies can help you build a foundation for the lasting change. As we move on to the next step in our miracle framework, keep building those habits and watch your motivation grow. Up next, we'll delve into identifying the root causes of your constipation and how to tailor remedies to address them effectively. Now that we have discussed the importance of motivation and building sustainable habits, it's time to dive into identifying the root causes of your constipation. This step is crucial because understanding what's causing your constipation allows you to tailor remedies specifically to your needs. Remember, treating the symptoms without addressing the root causes is like putting a band-aid on a bigger problem. So let's uncover the key factors that might be contributing to your constipation. So let's start with dietary issues. What you eat plays a crucial role in how well your digestive system works. We all know that. We have discussed extensively in our previous chapters and episodes as well. So ask yourself these questions. Are you consuming enough fiber? Because fiber is essential for adding bulk to your stool and helping it pass through the intestines. If your diet is low in fiber, it can lead to hard, dry stools that are difficult to pass. Number 2, are you drinking enough water? We all know hydration is key and water helps soften the stool, make it easier to pass. Without enough water, your body will draw water from the stool and make it hard and leading to constipation. Number 3, are there specific foods that trigger your symptoms? Some people may have food intolerances or allergies that can cause digestive issues. Common culprits include dairy, gluten, and certain types of FODMAP. Number 4, do you have any dietary preferences or restrictions, maybe for religious reasons or personal choices? Because it's important to consider your dietary choices, whether you are a vegan, vegetarian, or follow any specific religious diet. We need to respect those choices while finding effective remedies. And by evaluating our diet and considering any preferences or restrictions, we can make changes that can directly impact our bowel health. Increase your intake of high fiber foods like fruits, vegetables, and whole grains, and ensure that we are staying well hydrated. Next, let's look at lifestyle factors. Our daily habits and stress can significantly affect our digestive health. So let's ask or consider these questions. Number one, how much physical activity do you get daily? Exercise helps stimulate intestinal activity. Even simple activities like walking can make a huge difference. I learned that even walking 3,000 steps a day had a direct impact on my constipation the following day. Number two, how would you describe your stress levels? High stress can affect your digestive system, slowing down bowel movements. Finding ways to manage stress, such as through meditation, yoga, or deep breathing exercises, can help. Number three, do you have regular sleep patterns? Poor sleep can disturb your natural rhythms and secretion of melatonin, which helps in to going to sleep. And poor melatonin secretion and breaking the natural rhythms can disrupt digestion. So, aiming for 7 to 9 hours of quality sleep each night can help. Number four, what are your lifestyle preferences and limitations? Do you have any physical limitations or specific lifestyle choices that can affect your daily routine? It's important to tailor remedies that fit the lifestyle and the capabilities. By addressing these lifestyle factors and respecting preferences and limitations, you can create a more supportive environment for your digestive health. Next, let's talk about medical conditions, because medical conditions can also play a significant role in constipation. It's important to identify and manage any underlying health issues. For example, ask yourself, do you have any medical conditions such as hypothyroidism, diabetes, or IBS or IBD? These conditions can slow down your digestive system or cause other disruptions that can lead to constipation. Number two, are you taking any medications that might affect your bowel movements? We have talked about this in detail in previous episodes. Certain medications such as painkillers, antidepressants, iron supplements can cause constipation as a side effect. Now, if you suspect that a medical condition or medication is contributing to your constipation, obviously it's crucial to consult with your healthcare provider to manage these effectively. Finally, let's assess the severity of your constipation. Understanding how severe your condition is will help determine the urgency and type of remedies needed. So consider these questions. How often do you experience constipation? Is it an occasional problem or a chronic issue? How severe are your problems? Are you experiencing mild discomfort, or is it significantly affecting the quality of life? And number three, have you noticed any changes in your bowel habits recently? Sudden changes can indicate underlying issues that may need immediate medical attention. By evaluating the severity of the constipation, you can prioritize your treatment approach. For mild cases, simple dietary and lifestyle changes may suffice, and for severe cases, it's essential to seek professional medical advice. Now, let's move on to the next section, and let's recall what we have discussed in our previous chapter. How different organs, enzymes, nutrients, vitamins, microbes, and hormones play a role in constipation. So identifying root causes through test can provide a clearer picture. Now ask yourself the following questions. Have you had any tests to identify nutrient deficiencies? For example, tests for vitamins and minerals like magnesium, calcium, and iron can reveal deficiencies that can contribute to constipation. Number two, have you had your thyroid function tested? Thyroid functions can help diagnose hypothyroidism or common cause of constipation. Number three, have you had any test for enzyme levels? Enzyme deficiencies can be diagnosed through specific tests, helping to tailor your diet or enzyme supplements accordingly. Have you been tested for gut microbiome imbalances? Stool tests can reveal imbalances in gut bacteria that may be contributing to constipation. And have you had any hormonal evaluations? Hormone tests can identify imbalances such as estrogen, progesterone, or cortisol, which may impact bowel movements. So by understanding these root causes through various tests, you can create a more effective and personalized plan for managing constipation. So identifying root causes for your constipation is the first steps towards effective personalized treatment. So in our next segment, we'll discuss how demographics can influence your choices of remedies and how to tailor them to your specific needs. Stay with us as we continue to build your personalized plan for relief. So, in this segment of Miracle Framework for Personalizing Home Remedies for Constipation, we're going to talk about remedy by demographics. We will focus on how your age, biological sex, and specific life conditions influence the remedies that work best for you. Understanding the unique needs of different demographics is crucial for effective constipation relief. Let's start by looking at age specific remedies. Constipation can affect, obviously, people of all ages, but the causes and effective remedies can vary significantly depending on your age group. Here are some questions to ask to help personalize remedies based on the age. Let's start with for babies and young children. Is your child drinking enough fluids? Are they consuming fiber-rich foods appropriate for their age? Do they have regular bathroom habits? For example, home remedies like high-fiber cereals and plenty of water work well for adults, but for babies, pureed prunes or pears are more suitable as they are gentle on their digestive system. And for adults, are you balancing your diet with enough fiber and hydration? Are you managing your stress levels and getting your exercises? Because adults can handle raw vegetables and whole grains to increase fiber intake, but these might be too harsh for young children and the elderly who may need cooked or pureed vegetables to aid digestion. And for elderly, are you taking medications that might cause constipation? Are you staying active and drinking enough fluids? Because elderly individuals might need fiber supplements and gentle physical activities like Tai Chi, whereas young adults might benefit from high intensity workouts and raw fiber rich foods. So, by tailoring remedies to the age group, we can address specific factors that contribute to constipation at each life stage. Now, let's talk about biological sex specific considerations. Because biological sex can influence constipation and its remedies. Men and women may experience constipation differently due to physiological and hormonal differences. So here are some of the questions to help personalize home remedies on gender. For women, are you experiencing hormonal fluctuations such as during menstrual cycle or menopause? Are you pregnant? So high intensity workouts and certain herbal teas are effective for women in general, might not be safe during pregnancy. Pregnant women should opt out for gentle exercise and safe pregnancy approved remedies like increased water intake and high fiber food. And for men, are you maintaining a balanced diet with enough fiber? Are you staying physically active? So men might find relief from constipation through high intensity exercises like weightlifting, which may not be suitable for pregnant women who need gentle, low impact activities. So by understanding the unique needs based on biological sex, you can create a more effective plan to combat constipation. Finally, let's consider specific life conditions that can influence constipation. These conditions require tailored approaches to manage and relieve constipation effectively. So here are some questions to help personalize based on life conditions. Obviously, during pregnancy, it's very prevalent to have constipation. So asking questions such as, are you drinking enough water, eating high fiber food? Are you doing safe pregnancy-friendly exercises? Because pregnant women should avoid certain herbal remedies and high-intensity exercises that might be effective for others. Instead, they should focus on safe, gentle remedies like staying hydrated and engaging in prenatal yoga. And working with your doctor, some may also talk about taking stool softeners or other laxatives. Again, that must be tailored to the pregnancy needs. And for elderly, we have already talked about home remedies involving heavy physical exertion or certain high fiber foods like that are beneficial for younger adults might not be suitable for the elderly. Instead, they also may need gentle approaches like Tai Chi, yoga, or some fiber supplements and cooked vegetables and foods. Another very common constipation is during while traveling. So the questions you want to ask is, are you maintaining your usual diet and hydration level? Are you finding ways to stay active? especially when you are on a long bus travel, 8-10 hours, or long flight travels and train travels for overnight travels. You're just sitting on a chair, being very inactive, and that can also lead to constipation. And also, traveling can disrupt the routine. So, remedies like maintaining hydration and engaging in simple exercises can be more practical because at home there we have more control over the environment. But while traveling, we may not have that, and we may have to plan our travels. And if we need any supplements or any laxatives or any other herbal supplements, we can pack it in advance during travel so we can live or enjoy our travel. So another very common constipation is during post surgery, because post surgery you have to be bedridden or recover from it. You may be living a sedentary lifestyle post surgery. So, and also you may want to ask the following questions: are you on pain medications that could cause constipation? Are you able to move around and stay active? So you have to discuss with your doctor about managing constipation caused by pain medications or any side effects of any surgery. So, and also whenever possible, engage in light, safe physical activities that are recommended by your healthcare provider. So post-surgery patients might need specific guidance on managing constipation caused by pain medications and limited mobility, unlike healthy adults who can follow dietary and general exercise advice. Next are athletes. Even athletes, the question you must ask is, are your dietary restrictions impacting your fiber intake? Is your training regimen affecting your bowel movements? Because athletes can induce heavy strain and stress to the body, and they may be traveling in different time zones, and that can impact circadian rhythms. So you have to be extra careful as an athlete to maintain your bowel movements. So therefore, athletes may need to adjust their diet, hydration to accommodate intense training, take supplements for different enzymes and different minerals and so on, because the general diet may not be adequate. And obviously, constipation may be triggered by chronic illness, such as, are you managing conditions such as diabetes or multiple sclerosis or any other chronic illness? And another question to ask is, are your medications affecting your bowel movements? So, because patients with chronic illnesses may have very specialized remedies and adjustment that differ significantly from standard advice. So, by considering these life conditions, you can tailor your approach to managing constipation effectively, no matter the situation. And personalizing home remedies based on demographics can ensure that you are addressing unique factors that affect you. In our next segment, we will explore how your body type and meal patterns influence your digestive health and how to adjust your remedies accordingly. Stay tuned as we continue building your personalized plan for constipation relief. In this segment of our miracle framework for personalizing home remedies for constipation, we will focus on how your body type, both physiological and Ayurvedic, affects the remedies that work best for you. Understanding your body type is essential for tailoring remedies that will be most effective. So let's start with the physiological type. So physiological differences between male and female can influence how we respond to various remedies for constipation. Here are some questions to personalize remedies based on physiological body types. First, let's discuss the common male body types. Ectomorph. So characteristics are lean, slender, less body fat and muscles. For the recommendation, them would be high fiber diet, healthy fats and strength training. For endomorph body type, which are they can store more fat, lots of muscle, and they can gain weight easily. So obviously recommendation would be balanced diet, regular exercise and hydration. And for third, mesomorph. So characteristics are very athletic, strong, neither overweight or nor underweight. So for them, like even moderate fiber intake, obviously they are going to have active lifestyle, and hydration and balanced diet are recommended. And now let's go to the common female body type. So they are pear or triangle. The characteristics are narrow shoulders than hips, weight distributed in buttocks, lower hips and thighs. The inverted triangle, the characteristics are lower body smaller than top, shoulders wider than hips and large chest. Rectangle, like no major definition at waistline and hips, similar hip and shoulder width. An hourglass, top and bottom halves equally broad but smaller waist. Number 5 is oval or apple shape, narrow top and bottom halves with carried on chest and stomach. So the recommendations for each of the body shapes, body types would be very different. For example, for pear or triangle, like high fiber diet, high physical activity and hydration. For inverted triangle, okay, obviously high fiber food, balanced exercise and mindful eating. For rectangle, also fiber sources, exercise and consistent hydration. For hourglass, you need to balance the fiber intake, holistic exercises, and hydration and healthy fats are recommended. For oval, lean protein and fiber, regular movement, and hydration and portion control. So, by understanding these physiological differences in body type, you can tailor your approach to managing constipation more effectively. Obviously, if you are hourglass type or pear shape or different body types, you can ask yourself, what body type am I and what is more suitable for my body type? And there is another very interesting way of categorizing. And I'm from the Indian subcontinent. I'm from Nepal, so we are very naturally think about these Ayurvedic body types such as Kapha, Pitta, and Vata because we hear about everywhere in our culture. So we want to explain that in here as well. So Ayurveda classifies body types into three different dosas: Kapha, Pitta, and Vata, each with unique characteristics and needs. So here are some questions to help on the personalized remedies based on Ayurvedic body types. So for Kapha type, you can ask, are you calm, ready, or prone to sluggish digestion? Obviously, for recommendation for them could be warm and stimulating food, vigorous exercise, and you need to avoid heavy and oily foods. And choose lighter meals to prevent slowing down digestion. For example, Kapha individuals might benefit from starting the day with the spicy ginger tea to stimulate digestion, whereas Vata might need something more soothing. And for Pitta, you can ask yourself, are you fiery, you have strong digestion, or prone to inflammation? And the dietary recommendations or recommendation for them is cooling or hydrating foods. Focus on cucumbers, melons, leafy greens to balance heat. And obviously, moderate exercise include like swimming or yoga to avoid overheating. And obviously, avoid spicy and acidic foods. Choose milder meals to prevent digestive discomfort. For example, Pitta individuals might find relief in cooling herbal teas like peppermint or chamomile, whereas Kapha types might need more stimulating spices. Finally, for Vata type, are you airy? Do you have variable digestion or prone to dryness? Dryness everywhere, skin, lips, and all the places. For those, like recommendations are warm and grounding foods include cooked vegetables, soups, and stew to support digestion, and gentle and grounding exercises. Engage in walking or tai chi to promote relaxation, and obviously avoid raw and cold foods. Choose warm meals to prevent digestive disruptions. So Vata individuals might benefit from warm, hearty soups to soothe digestion, while Pitta might need more cooling salads. Again, by understanding the Ayurvedic body type, you can choose remedies that align with your natural constitution that will enhance your effectiveness. So personalizing home remedies based on your body type ensure that you're addressing the unique factors that affect you. In our next segment, we'll explore how availability of remedies, both local and seasonal, can influence your choices and effectiveness. Stay tuned as we continue building your personalized plan for relief. In this segment of our miracle framework for personalizing home remedies for constipation, we will focus on assessing your capability and opportunity to implement these remedies effectively. Let's dive in. So, understanding your skills, tools, and access to resources is crucial for choosing the right home remedies. Let's start by evaluating these aspects. Number one, evaluating skills and tools. First, let's consider your skills and tools that you have available. Ask yourself these questions. Number one, do you know how to prepare basic home remedies like herbal teas or fiber-rich meals? Do you have the necessary kitchen tools such as blender, juicer, or even a simple pot and stove? Are you comfortable using these tools to create remedies? For example, with limited skills and tools, if you are not confident in your cooking skills and only have basic kitchen equipment, maybe simple herbal teas, prepackaged fiber supplements, or maybe hydration, increasing water intake, which doesn't require any skills or tools. For example, if you have advanced skills and tools, you are comfortable in the kitchen, have access to a wide range of kitchen tools, maybe the complex recipes, prepare high fiber meals like vegetable soups, smoothies, or homemade yogurt with probiotic. Maybe You can do DIY fermentation, make your own fermented foods like sauerkraut or kimchi or to boost your gut health. Or maybe if you have blender-based remedies, use a blender to make fiber-rich smoothies or vegetable juices. Next, let's evaluate your access to resources and ingredients. And ask yourself these questions about access to resources. Do you have access to fresh local ingredients or nearby grocery store? Can you order specialty items online if you are not available locally? Do you have a garden or community space where you can grow your own herbs and vegetables? For example, if you have limited access, maybe you live in a remote area with limited access to fresh produce and specialty ingredients, the good recommendations for you is use dry goods, use shelf-stable ingredients like dry herbs, canned beans and oats, simple hydration, focus on hydration, which require only access to clean water, or maybe you can do bulk ordering for fiber supplements or non-perishable health foods in bulk online. Or if you live in extensive access, maybe you live in urban areas with access to a variety of fresh produce, health food stores, and delivery services, recommendation would be fresh produce. So incorporate wide variety of fresh fruits and vegetables in your diet for natural fiber. Specialty items, use specialty health foods like chia seeds, flax seeds, and kefir for gut health. And you can do home garden, grow your own herbs like mint, basil, parsley to use in remedies. So understanding your capabilities and opportunities allows you to choose remedies that fit your lifestyle and resources. Whether you are a kitchen novice with a limited access or a culinary expert with abundant resources, there is a personalized remedy that works for you and that can work for you. In this segment of Miracle Framework for personalizing home remedies for constipation, we'll focus on utilizing local and seasonal availability. So harnessing the power of what's locally available and in season can significantly enhance the effectiveness of your remedies. Let's dive in. So using local and seasonal ingredients not only support your local community, but also ensures that you are getting the freshest and the most nutrient-rich foods. Let's start with how to make the most of local remedies. Number one is utilizing local remedies. Local remedies can be incredibly effective because they are often tailored to a specific environmental and cultural condition of your area. Here are some examples. For example, if you're living in urban areas, access to health food stores and farmers market, you can use fresh herbs. Farmers market purchase fresh fiber-rich vegetables and fruits like apples, berries, and carrots and leafy vegetables, and also local honey, because incorporated local honeys can add natural sweeteners with mild laxative properties. Now, if you live in rural areas, right? Living in rural areas with access to homegrown produce and local farms, you can use homegrown vegetables, wild herbs, and local eggs and dairy. So your recommendations would be entirely different based on where you live, with what access you have, what locally available ingredients you have, and that can be immensely useful to tailor your home remedy. So another point which we need to think about in local availability is that the seasonal variety, right? Not only that, but also depend on where you live, the availability can be entirely different. For example, if you are locally in Bombay, India, and you are in Boston, India, your availability may be entirely different. For example, if you are living in Bombay, India, which is currently called Mumbai, which is a tropical climate with access to wide variety of fruits and spices, the recommendation of mangoes are very seasonal, papayas throughout the year. These tropical fruits are high in fiber and help in digestion, so you can use them in smoothies or salads. For example, coconut water, which is very highly refreshing and rich in electrolytes such as potassium. And if you have potassium deficiency, obviously you can start drinking coconut water if you are in Bombay or any tropical region. Another thing is spices, that turmeric or ginger, known for their anti-inflammatory properties. These spices can be added to teas or meals to improve gut health. And obviously, if you live in temperate areas like I do in Boston right now, there are special things that are available here, for apples and berries, maple syrup, or cranberries, which is known for digestive health benefits. Cranberry juice can be used for or in dried forms in salads. So the local ingredients can be really helpful in designing your personalized remedies. Now, after local availability, let's talk about making the most of seasonal ingredients. So seasonal ingredients are at their peak in terms of flavor and nutritional value. Here are some of the examples of how seasonal availability can vary home remedies. That's in spring and summer. In spring and summer, access to fresh seasonal fruit during the warmer months. Spring greens, berries, stone fruits, cucumber, melons. And fall and winter, there is access to more hardy seasonal produce during the colder months. Root vegetables, because we can use root vegetables like carrots, sweet potatoes, beets in soups, stews, and roasted dishes. They provide essential fiber and nutrients. Squash and pumpkins, citrus food, we can enjoy citrus fruits like oranges, grapefruits, and lemons, which are abundant in winter and help maintain hydration and digestive health. So these days, because of the globalization, these things can be available all around the year, but at the same time, your body conditions for seasons. And if you can use seasons, the effectivity of the home remedies can be entirely different. So again, local and seasonal. By utilizing local and seasonal ingredients, we can create effective, nutritious, environmental friendly home remedies. This approach not only enhances the flavor and nutrient content of the meals, but also supports sustainable and practices and local economies. And now, after assessing the local and seasonal availability, we can tailor our home remedies to what's fresh and accessible, making them more effective and enjoyable. So in our next segment, we'll explore how affordability can impact our choices of remedies and how to balance cost with effectiveness. Stay tuned as we continue building your personalized plan for constipation relief. In this segment of our miracle framework for personalizing home remedies for constipation, we'll focus on evaluating affordability. Whether you have time but limited funds, some disposable income, or busy schedule with ability to spend more, there are effective remedies to fit your needs. Let's explore how to balance cost and effectiveness. Affordability can significantly impact your choice of remedies. Let's start with cost-effective DIY solutions for those who have time but can't afford expensive treatments. DIY solutions are perfect for those who have time but are on tight budget. Here are some examples. Homemade fiber-rich foods for natural laxatives, prune juice or lemon water, obviously hydration, infused water. And we'll talk more about these in the home remedies section. But here in this case, like we are just giving you a framework to think about what are choices that you have. If you have time, but you can do it, but do not have disposable income, you can have DIY solutions which are cost effective. Next, if you have some disposable income and are looking for convenient solutions, there are some effective solutions. For example, you can take high quality supplements, probiotic supplements or magnesium citrate, which can help relax muscles in digestive tract and stimulate bowel movements. You can take convenient fiber products such as psyllium husk or prebiotic fiber mixes, and you can obviously take specialized food products which has high fiber snacks. So these purchase solutions can save you time and provide effective relief. And now for those who have a busy schedule and can't afford targeted solutions, let's explore some premium options. Those target solutions for those who can afford them. Some of the examples such as professional services, obviously personalized nutrition plan. You can hire nutritionists to create a more customized plan tailored to your specific needs. This can ensure that you are getting the right nutrients to prevent constipation. You can join health gut health programs. Obviously, you can purchase the high-end supplements and products such as advanced probiotic supplements. You can purchase digestive enzyme blends. And if you don't have time for delivery, you can go shop for grocery. You can do meal delivery services for healthy meal kits. You can subscribe to meal delivery services that offer high fiber, gut-friendly meals. This is a convenient option for maintaining a healthy diet without time commitment of cooking. So, by evaluating your affordability, you can choose remedies that fit your budget and lifestyle. Whether you prefer cost-effective DIY solutions and can afford some purchase products or offer targeted professional services, there are effective options for everyone. Personally, I choose 80% of time DIY solutions, zero-cost solutions, and sometimes when absolutely necessary, I take some supplements, but mostly I prefer DIY. Actually, it doesn't take that much of a time if you but again, the time commitment progressively decreases because you start developing skills and become expert in creating those home remedies. So again, your affordability should not be the issue for choosing the right home remedy for us. And assessing the affordability allows you to balance cost and effectiveness, ensuring that you get the most out of your home remedies. And in our final segment of this chapter, we'll review the entire miracle framework and help you put together your personalized plan for constipation relief. Stay with us as we wrap up this chapter. As we wrap this chapter, let's recap the miracle framework for personalizing home remedies for constipation. First, we explore the importance of motivation. Understanding your motivation levels is crucial for staying consistent, and we talk about building habits because motivation can be fleeting. Next, we move to identifying root causes, where we looked at dietary issues, lifestyle factors, medical conditions, and severity of your condition. Then discussed remedy by demographics, telling remedies to age, biological sex, specific life conditions. Following that, we assess body type, considering physiological and Ayurvedic approach. Then we evaluated capability and opportunity, ensuring you have necessary skills, tools, and access to resources. After that, we highlighted the importance of local and seasonal availability, utilizing locally available ingredients and making the most out of seasonal produce. Finally, we examine affordability, offering solutions that range from cost-effective DIY remedies to premium targeted options. So personalizing your home remedies is essential because it addresses your unique needs and circumstances. A one size fits for all approach rarely works. But using the miracle framework, you can develop a plan tailored to your specific needs and specifically for you. I encourage you to take a moment to assess your own situation, reflect on your motivation, identify your root causes, consider your demographics and body type, evaluate your capability and opportunity, look at what's locally and seasonally available, and consider your budget. Use the miracle framework as your guide. So, in our next chapter, we'll dive more into natural DIY remedies to address these deficiencies, root causes effectively. We'll explore how to create personalized, effective solutions right from your kitchen. You won't want to miss it. Today, I'm excited to share my complete morning to night routine that has helped me transition from merely surviving to thriving and elevating my gut health. I will walk you through each part of my day, providing you with a practical DIY natural home remedies for constipation relief and overall gut health. Let's get started. My morning routine, I start my day between 6 a.m. and 7 a.m. with some gentle stretches. I stretch up to the right side and the left side. This helps wake up my body and get the blood flowing. Next, I drink about 1 liter of warm salt water while in a squat position. I swish it around my mouth before swallowing. This is known as Usapana in Ayurveda and provides a double bonanza, ionic flow and rehydration, while acting as a mild stimulant laxative. If the warm salt water doesn't work, I do some squats, twist left and right, go up and down the stairs, or do pull-ups. Then, I use the toilet in the squat position with my knees above my hips, and I wash with a hand bidet after I'm done instead of using toilet paper. After this, I exercise for 30 minutes. I used to run before, but these days I do HIIT workouts with my wife. We usually exercise indoors, so seasonal variations don't matter. But when it's not raining or snowing, we enjoy running or walking outside. After sweating it out, I take a cold shower. Yes, even in Boston winter, I take it. After my shower, I meditate for 30 minutes. I used to do an hour of low-impact exercises such as walking, an hour of meditation, but I found that 2 hours was unsustainable with my busy schedule. Now I balance 30 minutes of HIIT and 30 minutes of Vipassana meditation, which works perfectly. By 8 or 9 a.m., my morning routine is complete. Post-morning routine, after my morning routine, I make a hot lemon honey drink or sometimes fennel seed tea or simply drink plain warm water. I stand while working mostly around 10 a.m. And around 10 a.m., I have a small breakfast. Most of the time, I don't even eat breakfast. Typically, 3 years ago, I ate oatmeal with nuts and yogurts, ensuring I get enough fiber, both soluble and insoluble, and I keep standing while working. So things have changed. Around 12, I have a light lunch, usually consisting of pulses and green vegetables, whatever is in the season. So I keep drinking warm water throughout the day. I avoid coffee, tea, and any caffeine. I've also stopped drinking any alcohol. Not that I used to drink a lot, but after lunch, if time and weather permit, I take a 30-minute walk. If not, I get back to work straight. I usually stop working around 5 p.m., although sometimes I work after dinner as well. We aim to have dinner before 6 p.m. So there was a time when we did yoga in the evening, but I have found that morning exercise is more effective, and we alternate between HIIT and yoga, with yoga on rest days. On weekends, we do a long yoga session for an hour and go for hikes or long walks if we are not traveling or socializing. And after dinner, we go for a walk if the weather is nice, or we do household chores. We make sure to have at least 3-hour gap between our last meal and sleep. I generally sleep between 10 p.m. and 11 p.m. I aim to get at least 5 cycles of sleep, with each cycle lasting about 1.5 hours, so it's 7.5 hours of sleep. Exercising in the morning, avoiding food before sunset, not drinking a lot of water after 8 p.m., and getting exposure to natural light have set my circadian rhythm, so allowing me to sleep naturally. For the last 2 years, I haven't experienced even mood swings even in winter. And also, I want to add here some few tips. So set your phone to do not disturb mode and keep it on a night mode to block the blue light during the night. And when I have trouble sleeping, reading or meditating helps a lot. So besides these, I don't have any other extra routines for sleep. No extra investments in beds, mattresses, or supplements. These things simply work for me. You might notice I have flexible intervals for waking up and sleeping. So being too strict with my schedule added stress. So having flexibility has brought me a peace of mind. I used to wake up strictly at 4 a.m. and used to go sleep at 9 p.m., but missing the routine only caused me guilt. Now I allowed myself to forgive and smile about it. This mindset shift came from a 10-day Vipassana meditation retreat. And after maintaining this for 3 years, I've realized I repaired my gut. Not only did I survive chronic constipation, but I also restored my gut health. This journey from survivor to restore was an organic progression. I became more thoughtful about diversifying my diet, adding healthy fats and fermented foods, and avoiding processed food. Now I have graduated to elevating my gut health further. I stopped using a lot of chemicals and started going out into nature more. Occasionally, I fast for 24 hours, and most days I follow intermittent fasting for 16 to 18 hours. Gut microbes thrive in fasting and exercise. However, being a Vata type and having a past history of gastritis, I monitor my symptoms very closely and adjust my meals accordingly. Most of the days, I start my meals with yogurt for its calcium, probiotic, and protein. And also, as I exercise more, adding more protein has been crucial since, again, I mentioned I increase my exercise routine. And occasionally, I indulge in pasta or pizza on cheat days, but I don't do it regularly to avoid triggering constipation. I keep track of my bowel movements, aiming for snake-shaped tools without pain or effort, ideally right after waking up. My bowel movement frequency is usually twice a day, once immediately after waking up, after drinking water, and after breakfast or any first drink. Sometimes it varies between once and 3 times a day, and it's okay. This has been my journey from fighting constipation to surviving, restoring, and now elevating my gut health. All of this without spending a lot of money, focusing on DIY natural home remedies. I've spent thousands of hours learning and experimenting, becoming the scientist of my own body, understanding my problems better than anyone else, and piloting my health plan. Now let's summarize my daily routine briefly. Again, I wake up between 6 and 7 a.m., start with stretches, drink warm water, exercise for 30 minutes, meditate for 30 minutes, and get on with my work while staying hydrated and standing most of the time. I have light meals, avoid processed foods, and incorporate walking and evening relaxation to wind down. So this routine became sustainable for me the through the momentum and built habit stacking. Each part of my days flows into the next, building on the previous habit and creating a seamless, healthy lifestyle. And by maintaining flexibility and allowing myself to adapt, I have found a routine that works for me for long term. And all these steps were guided by my miracle framework, focusing on motivation, identifying root causes, tailored remedy to my needs, assessing my body type, utilizing my capability and opportunity, focusing on local and seasonal food choices, and finally, evaluating affordability. This framework helped me structure a comprehensive and personalized approach to managing my constipation and enhancing my gut health. Thank you for joining me in this chapter of my journey. I hope you find these insightful and routines helpful. Remember, consistency and personalization are key. And if you have any questions or want to share your experiences, leave a comment below. And obviously, don't forget to like, share, and subscribe for more content on managing constipation and improving your gut health. As we wrap up this comprehensive guide to personalized DIY natural home remedies for immediate and long-term constipation relief, let's take a quick moment to recap what we have covered today. We began by understanding the root causes of constipation and debunking common misconceptions that might be holding you back from finding relief. We explored why overuse of laxatives, ineffective fiber supplements, and relying solely on exercise might not be enough to address your constipation issues. By focusing on root cause analysis, we emphasize the importance of identifying underlying root causes and tailoring remedies to your specific needs. Next, we delved into how different organs contribute to constipation, from the roles of nervous system, digestive system to impact of endocrine, circulatory, and immune systems. We covered how each of these play a significant role in maintaining regularity. Understanding these connections is crucial for developing a holistic approach to managing constipation. We also discuss the importance of sufficient nutrients, enzymes, vitamins, and gut microbes. We highlighted macronutrients and essential minerals like magnesium and potassium, and vital vitamins such as vitamin D and B vitamins. Additionally, we explored how digestive enzymes and gut microbes influence bowel movements and how hormones play the role in constipation. Following this, we introduced the miracle framework and personalized how home relief can work. This framework helps you assess your motivation, identify root cause, consider demographic factors, evaluate body types, and determine capability and opportunity. And by using local and seasonal remedies and evaluating affordability, you can create a personalized approach that works for you. Finally, I shared specific DIY natural home remedies for constipation relief. I walk you through my detailed journey of personalizing remedies, provided quick relief for home remedies for calming the pain, and shared my full day routine for permanent constipation relief and gut health. I hope you found these insights and practical tips really helpful. Remember, consistency and personalization are key. Building momentum and habit stacking have been crucial in making these practices a sustainable part of my daily routine. By integrating these habits into your life, you can achieve long-term relief and improve your overall gut health. Before we end, I want to give you a sneak peek into our next episode. Traveling can often throw our routines off balance, leading to constipation and other gut issues. In episode 7, we will be discussing travel-friendly home remedies for constipation relief. I'll share my experiences and tips for maintaining gut health while on the go. Whether it's a short trip or a long journey, you'll enjoy how to stay regular and comfortable no matter where you are. Finally, thank you for joining me in this episode. If you have any questions or want to share your experiences, leave a comment below. And obviously, don't forget to like, share, and subscribe for more content on managing constipation and improving your gut health. See you in the next video.